Thanks, Brandon. One of the key provisions of President Obama's health care law goes into effect today. The health care exchanges, which are online marketplaces for insurance, are open for business. Now, customers can go online and look for the cheapest health insurance and see if they qualify for federal subsidies. Officials do say that there could be some problems with the exchanges, and it could take weeks or months to work out the kinks. And to talk about the health care enrollment, because we know that it can be kind of confusing, is Professor Thomas Dennison of Syracuse University. Well, thanks so much for being with us this morning. So obviously we've had this breaking news, new overnight. We have this partial government shutdown. So people, first question obviously are asking, well, how does that affect the new health care law?
Well, it's rather ironic that the health care law caused the government shutdown, but the government shutdown really will not affect implementation of the law at all.
Okay, so people they have to start enrolling
It can
today.
begin to look for insurance today.
Okay, well, I know some people were probably wondering, all right, well, what does this mean for me right now? But you said got to start anyway.
Well, for most Americans, it doesn't mean anything at all. If you currently have health coverage through Medicare or Medicaid, if you have coverage through your employer, essentially nothing changes.
How many people are really affected by this? How many uninsured people are there in this country?
There are between 40 and 50 million people in the United States who don't have insurance at some point during the year.
So what do they need to be doing? Because they may wonder, okay, you know, for those of us who have private health insurance, we have different plans that we get to choose from. Do they, or is there just one plan? How does it work?
No, there are many plans to choose from. So people who don't have health insurance currently need to begin to look for insurance now and sign up by January 1st. Failure to sign up results in a tax or a penalty of $95 per year or 1% of household income, depending on which is greater. And when you go on the exchanges, which is the electronic medium that you will use to look for insurance, there are essentially 5 different categories of plans that you can choose from.
And what do those kind of entail? Or some of them, you know, like how ours are, where sometimes you get greater coverage, you know, it's kind of all over the place.
It's exactly the same.
Yeah.
There are 4 different levels named after metals. There's platinum, gold, silver, and bronze. Obviously, bronze being the least expensive and least extensive coverage. There's also a catastrophic plan, high deductible plan for younger people who might choose to buy insurance that really covers you at the far end, but has a fairly high deductible at the beginning.
Lastly, what do you have for advice for people that are now going to be shopping for insurance? What would you say to them?
I would say take a look at the exchanges, poke around, get some advice. There are trained navigators who can help people muddle through the insurance. But I think it's a great opportunity for people who have not had affordable coverage before now.
All right, well, Professor, thank you so much for coming in. We know it's early, and I love your tie, too. I had to tell you that. Thanks for being here. Well, again, we know that this can all be very complicated, and we're going to help you sort through it even more. Tonight, we will have experts manning a phone bank and a web chat to answer your questions. It's happening during our evening newscast. That's from 5 to 6:30 p.m., and you can think of your questions right now, get them ready, and then you can call in tonight starting at 5 p.m.